Hello everyone. Thank you for joining us today. We're here to explore an extraordinary chapter in the history of medicine, titled The Accidental Miracle, the History of Penicillin. Penicillin, often hailed as the world's first true antibiotic, revolutionized the treatment of bacterial infections and has saved countless lives since its discovery. Its journey began serendipitously with Alexander Fleming's observation of mold inhibiting bacterial growth in 1928, a moment that sparked a series of scientific advancements and innovations. This groundbreaking discovery not only transformed medical practices but also laid the foundation for the development of modern antibiotics. Today, we will delve into how this accidental discovery came about, the challenges faced in its development, and its profound impact on public health and medicine as a whole. Let's embark on this fascinating journey through time. Alexander Fleming's accidental discovery of penicillin in 1928. This breakthrough revolutionized medicine and led to the development of antibiotics, saving countless lives. The story. While studying Staphylococcus bacteria, Fleming left a Petri dish out before going on vacation. When he returned, he noticed something extraordinary. A mold, later identified as Penicillium notatum, had grown on the dish and was killing the bacteria around it. Why it mattered. Fleming's discovery led to the development of penicillin, the world's first true antibiotic. This medical marvel paved the way for treating bacterial infections that were once fatal, including pneumonia, syphilis, and strep throat. Although Fleming made the initial discovery, scientists like Howard Florey and Ernst Boris Chain helped turn penicillin into a practical drug, changing the course of modern medicine forever. A true example of serendipity in science, a simple mistake that led to the fascinating connection between ancient Egyptian medicine and the use of moldy bread as a form of early antibiotic treatment. Ancient antibiotics? Egyptian hieroglyphics and medical papyri, such as the Ebers Papyrus, circa 1550 BCE, describe treatments for wounds and infections that involved applying moldy bread. The Egyptians may not have understood microbiology, but they recognized that mold had healing properties. Why did it work? Some molds, particularly those from the Penicillium family, naturally produce antibacterial compounds. These early healers likely observed that moldy substances helped prevent infections and promoted healing, an ancient precursor to penicillin. Ancient wisdom, modern science. This practice suggests that ancient civilizations had a basic understanding of the benefits of antimicrobial substances. Even if they couldn't explain them scientifically, it wasn't until Alexander Fleming's discovery of penicillin in 1928 that the world truly understood why mold could fight infections. A remarkable case of ancient knowledge aligning with modern medical breakthroughs. The envisioning a 1920s lab reenactment of Alexander Fleming's discovery of penicillin, with him deep in thought as he observes his Petri dish. Scene setting, Fleming's laboratory, 1928, St. Mary's Hospital, London. Dimly lit lab, cluttered with Petri dishes, test tubes, and scientific equipment. Stacks of bacterial cultures on Fleming's wooden workbench. A forgotten Petri dish with a moldy spot, Penicillium notatum, surrounded by a clear, bacteria-free zone. Fleming, in a white lab coat, leans in thoughtfully, perhaps stroking his chin or jotting notes in his lab journal. The eureka moment. Fleming notices that the mold is killing the surrounding bacteria. He ponders the significance. Could this mold be a weapon against infections? His mind races with possibilities, unknowingly setting the stage for the antibiotic revolution that would change medicine forever. The mass production of penicillin during World War II was a groundbreaking achievement that revolutionized medicine. Before penicillin, bacterial infections were often fatal, and there were limited treatments available. Penicillin, discovered by Alexander Fleming in 1928, showed great promise as an antibiotic but was initially produced in small quantities. However, during World War II there was a critical need for effective treatments for soldiers suffering from infections. In the early 1940s, American scientists, including Howard Florey, Sir Alexander Fleming, and Norman Heatley, worked alongside pharmaceutical companies to scale up production. The breakthrough came with the development of a more efficient fermentation process, enabling the mass production of penicillin. This led to the widespread availability of the drug, saving countless lives by preventing infections that could otherwise lead to death or debilitating health problems. The success of penicillin's mass production not only helped win the war but also laid the foundation for the modern pharmaceutical industry and the widespread use of antibiotics, transforming healthcare for generations to come. The Nobel Prize ceremony of 1945 was especially memorable due to the recognition of the groundbreaking work surrounding the development of penicillin, which had played a crucial role in saving lives during World War II. While the war was still ongoing, the Nobel Prizes were awarded in the fields of physics, chemistry, medicine, literature, and peace, with several individuals being honored for their contributions to science, particularly in medicine. The Nobel Prize in Physiology or Medicine was awarded to Sir Alexander Fleming, Howard Florey, and Ernst Boris Chain for their discoveries related to penicillin. Alexander Fleming had discovered penicillin in 1928, but it was Howard Florey and Ernst Boris Chain who, during the early 1940s, figured out how to mass-produce the antibiotic, making it available for widespread use, especially for treating infections among soldiers during the war. The Nobel ceremony in 1945 was notably held in Stockholm, Sweden. And it was a time of reflection on the end of the war and the tremendous impact that science and innovation had during the conflict. However, due to the war, some laureates could not attend. For example, Howard Florey was unable to make the journey to Sweden, but his work was recognized globally, and his legacy in antibiotic development is still highly regarded. This Nobel Prize not only recognized the development of penicillin but also highlighted the increasing importance of scientific collaboration across borders, especially during a time of global strife. The ceremony and the recognition of these scientists contributed to the lasting legacy of penicillin, forever changing medicine and saving millions of lives in the decades that followed. Modern challenges related to bacteria and antibiotics include the increasing prevalence of antibiotic resistance and the strain it puts on healthcare systems. Bacteria under a microscope reveal the complexity and variety of these microorganisms, which evolve rapidly to survive antibiotic treatments. The pillbox, often associated with antibiotics, symbolizes the reliance on these medications to combat bacterial infections. However, overuse and misuse of antibiotics have led to the rise of resistant strains, making it harder to treat common infections effectively. This challenge calls for more responsible use of antibiotics, as well as the development of new treatments and strategies to combat resistant bacteria. The overuse of antibiotics has led to the emergence of antibiotic-resistant superbugs, which are becoming an increasingly dire global health threat. Dorothy Hodgkin's groundbreaking work in mapping the structure of penicillin in the 1940s was revolutionary and laid the foundation for the development of many antibiotics. Her contributions continue to inspire new generations of scientists to explore innovative solutions to combat the growing resistance problem. Today, researchers are turning to alternative approaches, such as developing new antibiotics, utilizing bacteriophages, viruses that target bacteria, and exploring how microbiome modulation can help fight infections. In addition, there is a growing focus on better stewardship of existing antibiotics, ensuring they're used judiciously to slow the spread of resistance. The challenge remains, but the legacy of scientists like Hodgkin serves as a reminder of the importance of continued innovation in the fight against bacterial infections. From the trenches of World War II to the front lines of modern medicine, penicillin's journey is a testament to the power of chance, perseverance, and collaboration. What started as an accidental discovery has transformed the world, saving countless lives and shaping the future of healthcare. As we continue to build on this legacy, we must remember the lessons of the past, both the hope and the challenges. The fight against antibiotic resistance requires the same ingenuity and commitment that brought us penicillin. By using antibiotics wisely and responsibly, we honor the pioneering work of those who came before us and ensure that these life-saving treatments remain effective for generations to come. Let's keep the spirit of discovery alive. share in the wonder of science, celebrate its milestones, and be part of the movement to preserve the future of medicine. Like, subscribe, and stay tuned for more stories of science, innovation, and serendipity.